4.
Hello, everybody. Good afternoon. Welcome once again to a weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Vigili, Hispanic Public Information Officer, and joining us today is Acting Health Officer Dr. James Bridgers, as well as Dr. Earl Strader, Assistant Chief Administrative Officer, Sean O'Donnell, Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. Kimberly Thompson, she's with us today. She's a Senior Administrator for Communicable Disease and Epidemiology for the Department of Health and Human Services. And last but not least, joining us today as a guest is Maryland State Delegate Eric Lutke. Thank you, everybody, for joining us. Let's get started, Mr. County Executive. Good afternoon.
Good afternoon, and thank everyone for being here today. I'm happy to be joined by House Majority Leader Eric Lutke on the briefing with me. And I want to just mention that, he's been really critical to our economic development efforts in the East County. His work at the legislature was really instrumental in moving some of what we were trying to get done over there done. And it kind of culminated in a few weeks ago at the Burtonsville Shopping Center. We were able to announce that they had finally found the grocery store, Sprouts, and it's going to lead to revitalization of Burtonsville Crossing. And I know that's a big deal for residents in his district up there. And I was just really happy that we were able to get that done. Before we go over to that part of the meeting, I just want to touch on a few events in the community. Last night, we gathered for National Night Out. It's a time when our public safety officers get together with our communities, the ones they serve, and review some of their friendships and relationships that they've been able to develop, and people in the community get to talk to them about community safety issues. We've been doing this for the last 38 years, and I want to thank Chief Jones and MCPD and the Sheriff's Office, our municipal police departments, and all the community leaders from Silver Spring to Germantown for another successful night out. I think I wound up doing 5 or 6 of these last night. These annual gatherings represent a unique way for the community to connect with those who are in the county to serve and protect them. So I think it was a good opportunity for both residents and the folks in our public safety sector to get together and have an evening out. Today, I started over at the Test Center in Silver Spring. Test is moving to a new place, same neighborhood, different building. And it looks a lot nicer than the old one. And Tess has been a long time standard service center in Montgomery County. It was there when I moved to Tacoma Park 42 years ago. And they play an important role in connecting the community to services from our Health and Human Services Department and others. And our Community Action Agency, which is one of several dozen federally mandated groups that work with us to end poverty in the county. The center is now going to be able to continue its mission of helping the Long Branch community and others with food, housing, early education, and tax preparation. And thousands of residents receive assistance each year for this effort. And I want to congratulate them on their new building and location, and hope that it makes it even easier for people to find you. Tess really is one of the fixtures in the East County. Like I said, it's been doing this for 50 years now. And I'm really proud that we're able to find a home that keeps them at the heart of the community they work in. This weekend and next, Montgomery County will have 2 health fairs aimed at helping specific communities. On Saturday, you can join us for the Ama Tu Vida event in Montgomery College in Rockville. It starts at 11 o'clock. It's the first time we've had this health fair for the Latino community in person since 2019. And we had about 7,000 people show up back then. It also coincides with Salvadoran American Day, which also helps bring out a good crowd and will keep the campus busy till about 7 p.m. Then the following Saturday on the 13th, Montgomery County's African American Health Program and other DHHS maternal and early childhood health programs will host the Right from the Start event. And it focuses on several family health issues from preconception through early childhood. And one particular concern in the county is that Black women account for almost half of all the infant deaths and fetal losses in Montgomery County last year. And as we know, that's way out of proportion given their share of the population. So right from the start will be held at 10 a.m. to 1 p.m. at the White Oak Community Center in Silver Spring. These diverse and equitable outreach efforts are helping our county be healthier and safer. And our efforts are reflected in our outcomes, and I'm proud of the efforts and the work they're doing. Also protecting women's rights. Meanwhile, reproductive rights and women's health-related issues continue to generate headlines nationwide following the Supreme Court decision to overturn Roe v. Wade in June. Just this week, we learned about a court decision in Texas that will allow trigger laws to go into effect that could hold medical professionals criminally liable for performing abortions. That new measure is set to go into effect by the end of the month. An appellate court in Kentucky upheld trigger laws in that state, which ban abortions after 6 weeks of pregnancy. And women and families in places like Arizona, Michigan could also face similar hurdles. There are 10 states so far have permission to ban the kind of abortions that have been performed now for decades. Good news yesterday was out of Kansas, as their residents rejected an amendment via referendum that was going to restrict abortion rights. It's a significant victory in a very red state, and it highlights how out of touch the leaders in these states are with their own residents. It's reassuring to live in a state in the county that we are likely wouldn't have to go through a referendum like this. And it's because of the leadership we have, particularly at the General Assembly level with Delegate Ludke and Delegate Kelly and others. Our entire delegation is all on the same page on this, and who saw the writing on the wall earlier and worked to help protect women's rights months before the Supreme Court decisions. In May, after the leak of this decision, I directed the County Council to appropriate $1 million from the county budget to help abortion providers with additional costs they would incur because of the ruling, and we're finalizing how that money can be used in the form of grants. Our nonprofit providers of women's health and abortion services can expect that application process will open soon. And after the decision was formally announced, I also put in place new rules for county employees that effectively end official county travel to states with new abortion restrictions. I also call for an effort on our county's part to proactively go after businesses in states that have restrictions. Most recently, my officers, along with Delegates Kelly and Ludke, have reached out to key companies headquartered in cities like Austin, Dallas, Louisville, and Kansas City. If there's a chance that company leaders are exploring a move out of those states, we want to make sure that they know that Montgomery County is a place they can come to where we do value a woman's right to choose and are generally very welcoming and opening to a diverse population. There's a growing audience for this type of outreach. Variety magazine recently reported more than 400 female TV showrunners demanded that companies like Netflix, Disney, and Warner Brothers and NBC Universal offer safety protocols in states that restrict rights. This move was followed by an additional letter by another 594 male showrunners days later in the entertainment industry. Whether it's entertainment, big tech, or healthcare, health science companies are just small businesses. There are going to be many owners, members of boards, and employees that are going to demand the right to work in a state that respects their rights. And today, Delegate Ludke is joining us to talk more about this effort and answer any questions you may have. So I'm going to turn it over to Eric.
Well, thank you very much, Mr. County Executive. And let me first say thank you to the County Executive and the County Council for standing firm on protecting the right of women in Montgomery County and Maryland to make their own decisions about reproductive health care and abortion. I would second all of the County Executive's comments. I was happy to co-sign a letter with the County Executive, which he just mentioned, as well as Delegate Ariana Kelly, who is the chair of the vice chair rather of the Health and Government Operations Committee in the Maryland House of Delegates, to 10 large headquarters corporations, offering essentially our assistance if they are considering moving their headquarters as their employees demand access to basic healthcare rights. Those of us who work in economic development and in trying to bring businesses to Maryland have seen a significant increase in interest from companies in places like Austin and Dallas and Salt Lake City, whose employees are deeply worried about the impact of the recent Supreme Court decision, about the disrespect being shown to women and the rights of women to make their own healthcare decisions in many of these states. And we wanted to make clear to these companies that we are open to having them move here to Montgomery County, to a place where we will continue to respect the rights of their employees, to ensure that all of their employees, regardless of their gender, have access to healthcare, the full range of healthcare. Those companies include 5 companies that have previously expressed opposition to the Supreme Court's decision and support for their employees should they need to travel out of state to seek care. That includes Tesla, the Match Group, Dell, AT&T, and Hewlett-Packard Enterprise, as well as 5 major healthcare corporations: Humana, HCA, Centene, McKesson, and Cerner. I would add that we are continuing to talk to our partners in the business community, to work with county government and with state agencies in making clear to these companies that Maryland is an excellent place to do business. We have a fantastic workforce, one of the most highly educated workforces in the country, and we stand ready to host any of these companies and to talk to them about what they can do to move to Montgomery County and to Maryland at any time, and to the talent and employees that these companies hire. And I think the letter that the county executive mentioned from showrunners who work with companies like Netflix is a good example of that. There are billions of dollars going into film production and TV production in places like Georgia and Texas. And many of those employees and the companies have expressed opposition to the decision. Maryland is a great place to film, and we'd invite them to come here as well. So thank you to the county executive and to Delegate Kelly for standing firm on this. And I'm looking forward to continuing these conversations with these companies over the coming months.
Thank you, Delegate Lutke. Members of the media, do you have any questions at this moment just about this particular topic, either for the delegate or the county executive? We'll take the other questions regarding other topics after the COVID-19 public health update. So any questions about this topic right now?
Hey, Lorna, I'll jump in here.
Hi, good afternoon, Steve. Steve Bonnell, Bethesda Beat.
Good afternoon. Delegate Lutke, and I guess county executive can jump in here too. Is there any, when you're talking with these companies like the ones you listed, are financial incentives or other kind of perks kind of being offered in these conversations, not just, outside of, we have protections for women in the state constitution, is there any, I'm thinking of relocation costs, things like that. Just where do those discussions stand, I guess?
So we have standard programs both at the state and county level for attracting new businesses to both the county and state. And so we'll make sure, when we're soliciting, that we'll make the information available so people can evaluate what kind of assistance they can come to us and get. We do this already doing it with private sector companies. We're having success, obviously, particularly in life sciences and bringing people here. And we think we can offer attractive packages for people to come here.
I'd just add to that the state and the county both have robust incentive packages that are targeted to many of the companies that are most likely to move as a result of these decisions. Austin has a fairly large biotech and tech sector. So does Salt Lake City. There's large healthcare sectors in Louisville and in St. Louis. So these are industries that already have a strong presence in Maryland. In addition to biotech, we have a strong cyber sector. We have a strong video game sector, Bethesda Games, for example. And so a lot of similar companies, I think, would benefit from those same incentives.
I guess when you're looking at, you mentioned education level of people in the state, is that one of the main kind of cards you kind of offer? And also the size of the state relative to other states that have pretty strong laws. Those are just 2 factors that come to mind. Are those the 2 main things, or other things you two kind of want to highlight when you're pitching to companies?
There are a range of factors that are important to businesses in their business decision making and their location decisions. We do. I think Maryland has, and I'll just come out and say we're the best. We have one of the strongest, most highly educated, most technically skilled workforces in America. And a lot of that talent is concentrated in Montgomery County. It's a significant reason why we have such a strong biotech sector, why we have such a strong cybersecurity sector, space science businesses. So yes, that is a big draw for these companies, particularly in a time of a difficult labor market. But what this letter highlights that's important is, many of these business leaders have expressed publicly opposition to the Supreme Court decision. They have publicly said they support the right of women to choose their own healthcare decisions, to choose their own future. We want to encourage those companies to consider that as well in their business decisions, because their employees should have the right to access healthcare. And if the states they're located in right now are not providing access to healthcare, we will.
Thank you, everyone.
Thank you, Steve. Kate Ryan, WTOP, you have questions on this topic?
Thank you very much. And Delegate, you mentioned a number of companies. Again, is it just that Maryland has made the pitch to them, or have you already engaged in conversations? How serious, those are big names. How serious is the level of inquiry and the response that you're getting from these firms?
Sure. So this particular letter went out earlier this week. We have not yet had a response from any of the firms, but we are looking forward to talking with any of them. We essentially expressed that we're open to any conversations they want to have. But we have been hearing, and I've been hearing personally, anecdotally, of companies that are starting to look. And these particular firms are very large, multi-billion-dollar companies, but there are plenty of smaller firms, particularly in the tech sector, doing work like video games, data science, cybersecurity, who are starting to look around and say, if I want to attract the best talent, if I want to attract the best programmers, I need to be in a place where those programmers feel comfortable living. So yes, we are reaching out to those companies as well. Doesn't matter if you have 5 employees or 5,000, Montgomery County is open for business.
Got it. And lastly, there's always this, we're competing with Virginia. Do you know whether or not Virginia is kind of putting their skin into the game here? And are you competing with them on this issue?
Given who the current governor of Virginia is, I doubt that they're going to pursue this tactic.
Yeah, I can't see him doing that.
Thank you very much.
Thank you, Kate. Members of the media, any more questions on this topic? Once? Going twice? All righty then. Thank you, Delegate, for joining us today. Have a wonderful afternoon. And now we can move forward with the public health update, Mr. County Executive.
So again, thank you, Delegate Lukey, for being here. And we're going to go into where we are with COVID. This week, case counts and hospitalizations remain a concern. Just compared to where we were last year to today, we are close to 50 cases per 100,000 back then. Today, we remain above 200 cases per 100,000. And we've seen it be about that level for nearly a month now. So it has not ridden itself all the way down to the bottom again. It's why we're asking everyone to be ready to wear face masks voluntarily if you're in a high-risk setting, like a crowded indoor public place. The elevated community level status is also a warning for congregate settings like nursing homes to be more vigilant, test more and monitor conditions, and take COVID concerns seriously. This is not a time not to take the concerns seriously. It's still obviously out there. Our case rates are high. People are getting sick, whether they're already vaccinated or whether they've not been vaccinated. The outcomes just are worse for people who aren't vaccinated. We've seen more fatal cases of COVID-19 in June and July than we saw throughout the spring. Another trend we're seeing is in reinfection. Hospital records show us that even if you get COVID before, you can get it again. And natural immunity is not as strong as what people are getting from the vaccines and boosters. As we begin August and focus on back to school preparations, we'll be launching vaccine clinics that will allow parents to bring their school kids of all ages in for vaccines and boosters. Vaccines and boosters is something that should be a part of any back to school checklist that parents are putting together. But parents I know are familiar with the vaccines they already have to take when they come back to school. And for the time being, we should be thinking about this as another one of the vaccines that people are going to need to take. The first clinics are tentatively planned for August 14th, and we'll share more information as we approach the start of the school year. The vaccines and boosters are equally important for adults as well, and our county is still sitting at only 58% of our residents being boosted. We will continue to remind everyone that these vaccines do wane, and we don't know what to expect in the fall and winter, and it's critical for everyone to be up to date with their boosters. Shifting to another health concern, MPX. Montgomery County has been paying close attention to MPX, also known as monkeypox, since the outbreak began in May of 2022. MPX is a rare infection that is showing up more and more across the United States. According to the CDC, there are 149 cases spread across the state. District of Columbia has 248 reported cases. At this point, the state health department is not telling us how many cases originate or are being treated in Montgomery County. There is a virus that spreads after close contact with someone who's infected. Sometimes that's through sex. Other times it's through shared items like towels or clothing. Symptoms are similar to those of the flu, with common complaints like fever, headaches, muscle aches, followed by a skin rash. It can appear all over the body and look like pimples or blisters, but they can also be painful and itchy. Touching those scabs or sores is the most common way of spreading MPX. Respiratory droplets created when someone coughs or sneezes can also pass on the virus. So if you're in close contact with someone who tests positive for MPX, you might want to get tested. Doctors don't believe the virus stays in the air and has not been shown to linger on surfaces like doorknobs. If you feel sick, don't go out or have sex. It can be several weeks before someone with MPX is not contagious anymore. If you do get sick, there are treatments available, but the most important thing you can do is to distance yourself from others. Currently, our vaccine is very limited and is being given to people who've been identified as close contacts, to people who've already tested positive. We probably won't get any more doses until September. And that's why the health department has established a pre-registration program for anyone interested in the MPX vaccine. That will go live at the end of the week. And I'm now going to turn it over to Dr. Stoddard, Sean O'Donnell, Dr. Bridgers, and Kimberly Townsend for their updates.
So thank you, Mr. County Executive. I have no updates. Happy to respond to questions during the Q&A session. Turn it over to Mr. O'Donnell, who will walk us through, and then Ms. Townsend, who will give us an update where we are with our planning and MPX vaccination strategy.
Thank you, Dr. Bridgers. Okay, just starting with a very quick update on the variants that we're looking at. We are now at over 96% of our cases are projected to be either BA 4.6 or BA 5 across our region. Looking at what many of our states in our area are encountering, you can see that over the last few weeks, at a larger scale, many of these states have seen a fairly steady amount of cases, as the county executive was sharing with you all. That is kind of gone on. We've actually seen in our jurisdiction some slightly declining case or transmission rates within Montgomery County. But again, many of the northeastern and eastern seaboard states are showing fairly level amounts of transmissions, which are again much higher than we saw earlier in this year and this time last year. The other notable thing from this chart, looking at the states, is that even while cases have remained somewhat level over the last month or so, hospitalization rates in many of these states have continued to rise. Again, we've seen a little bit of fluctuation in our hospitalization rates here, but they've both new admissions and the staffed inpatient beds have been right around the 10 new admissions and 10% mark over the last week or so. That is, and with our transmission rates again remaining above 200, that has put us in the locally derived high level. Just to reiterate, many of the prevention strategies that the CDC recommends at that high level are things that we have been encouraging people over the last few months because of our transmission levels being so high. We've been recommending that people wear well-fitting masks when in crowded indoor public spaces, both to protect themselves and to protect other people. We know that there's a significant number of breakthrough cases now, so even up-to-date people with vaccinations can still, unfortunately, get and transmit the current variants. Again, at a community level, we continue to work with all of our congregate spaces, making sure that we're limiting outbreaks and putting in place preventative measures and that can help again reduce transmissions in those sectors. Looking at the death totals, again, we have seen some increases over the last 2 months. This is again linked to these variants that are transmitting at very high levels. And again, these are the most concerning stats that we're looking at. We certainly are working within our recommendations to try to bring down deaths attributed to COVID. The next few slides, I just very quickly want to reiterate again where we're seeing very significant differences, even with breakthrough cases, significant differences between those who are fully vaccinated and those who are unvaccinated. That includes the rate at which they catch COVID or are identified with COVID. That includes the rate at which they're hospitalized. You can see the hospitalization rates have gone up even for fully vaccinated individuals, again, as the newest Omicron variants are resisting some of the immunity we've developed, and potentially for individuals who maybe have not kept up with boosters. But what's very clear is those who are unvaccinated are being hospitalized at a much higher rate. Within our death rates, again, by vaccination status, you can again see that the highest rates are, of course, with or clearly with our unvaccinated populations, and it's very concerning. And again, we're just strongly recommending that anyone who hasn't been vaccinated yet, please consider getting the COVID vaccine. It has been very, very helpful. We want to remind all of our community, we're continuing to do those infant and toddler vaccinations on weekends in coordination with our Montgomery County public school partners. As the county executive said, beginning Sunday, August 14th, we'll begin incorporating not only those vaccines for the 5 and under, but we'll also have our 5 to 11 Pfizer and our 12 and up Pfizer, so that when a family comes out to get their younger children vaccinated, they can get boosters at that time, or first and second doses if they need it. I also wanted to update that we've placed our first order for the Novavax vaccine this week. It just became eligible for ordering. We've ordered some quantities of vaccine. What we'll likely do is place information on our website once we receive the vaccine. And for those individuals who have been waiting for this specific vaccine, we'll let you know how to contact us and we can set up appointments for that. One thing to keep in mind, the Novavax vaccine has been approved for anyone 18 and older who has not yet been vaccinated for COVID-19. It's a 2-dose vaccine initially. It has not yet been approved as a booster, but that may come down the line. And again, you can either look at the county website or either the CDC or Maryland Vaccine Finder and see where in the community different providers have this vaccine. Now I'd like to turn it over to Ms. Kimberly Townsend to talk a little bit about our monkeypox strategy, just sharing today's updated reported numbers.
Thank you, Sean. Good afternoon. So as stated earlier, there are 149 cases of MPX across the state of Maryland. wanted to mention that the Maryland Department of Health continues to maintain surveillance of all cases across the state.
Pardon me, Ms. Townsend, I can barely hear you. I don't know if it's just me. Can you speak up a little bit more so we can hear you
Yes.
better?
Is this
Thank
better?
you.
Okay, can you hear me better now?
Yes.
Okay, great. Thank you for letting me know. So the Maryland Department of Health continues to maintain surveillance of confirmed MPX cases across the state. Therefore, information specific to the number of cases within our county has not been shared with us yet. We continue to assist the Maryland Department of Health with their efforts through contact tracing and coordination of care, follow-up, and vaccination of contacts and those exposed as appropriate. In terms of vaccination, last week we received an additional delivery of doses of Novavax vaccine. It's still a very limited amount, and therefore we are providing vaccines to people that are at the highest risk for exposure. So currently vaccinations are available to known contacts who are identified by public health via case investigation, contact tracing, and exposure notifications. They're also provided for presumed contacts who may meet the following 2 criteria. Those that have had a known sexual partner in the past 14 days that was diagnosed with MPX, and those who have had multiple sexual partners within the past 14 days in an area with known MPX. So we encourage those that if they believe they've been exposed to monkeypox or MPX, or they're having symptoms, to contact their primary care provider or perhaps a community provider such as an urgent care center. If they do not have a provider, they may contact us at our disease control program. If anyone believes they're in a high-risk group category, and meet the criteria that I mentioned, they may contact us at our STI clinic program here at the Dennis Avenue Health Center, and someone can assist them with that. We are currently providing vaccination here for those that meet the criteria at the Dennis Avenue Health Center site. We've given approximately 140 appointments for vaccination, and we have approximately 60 appointments pending at this time. So we've been quite busy with that. We've also conducted some outreach that has helped us determine how many people may be eligible that are known to us. And that estimate is just under 500 at this time. So again, vaccine is very limited, and we are trying to meet the needs of those that are at highest risk at this time. To help us do so, we have developed an online pre-registration survey. This survey is for residents interested in receiving a vaccination to help protect them against MPX. And it will be initially focused on those that are highest at highest risk. So this survey will eventually be posted on our website. We're expecting that to happen sometime before the end of this week. And again, we're asking those that meet the criteria or feel that they are within one of those high risk groups to go ahead on the website and pre-register for a vaccine. And again, just to mention this, the type of vaccine we're providing is post-exposure prophylaxis at this time, meaning for people that have been exposed to someone with MPX or has presumed exposure to someone with MPX.
Thank you very much, Kimberly, for that presentation. Let's get started with the Q&A portion. I believe, Kate Ryan, you're number 1, WTOP. Welcome again. Good afternoon.
Thank you very much. Right off the bat on the MPX vaccines and why we don't have more available. My understanding is that globally there might be 16 million doses out there. and there is already concern that wealthier countries might stockpile this. What's the situation? I know people are, frightened of this illness and may be predisposed to get the vaccine, but when they hear that, you won't see any until September, that's alarming to them. What can you tell us about that?
Sure, Kate. Good afternoon. I'll start and others can chime in. So just as a comparison, the DC Department of Health received their doses directly from the federal strategic national stockpile. We, unlike DC, can't receive our doses directly, as Mr. Elrich indicated a couple of weeks ago in our weekly press conference. We receive our doses from the Maryland Department of Health. They are limited doses. The three larger jurisdictions in the state, Baltimore City, Montgomery County, and Prince George's County, received the initial tranche to administer doses to those individuals who were identified by the Maryland Department of Health as post-exposure. So we are working within the confines of demand, as we saw previously early on 29 months ago with the COVID-19 vaccine. We don't have a number. We are managing the doses that we have. We are putting just as many shots in arms as we possibly can regarding the demand based on not only our surveys, our community engagements, our discussions with our safety net providers and partners. And that's just the crux of it. When we get the doses in, we will put them out, but we don't know. We receive our information through survey with the Maryland Department of Health.
Understood that we get it from MDH, but I think my question is a little more basic than that. Is this a difficult to make vaccine? Is it a vaccine that used to be made, is made no longer? Is it related to the smallpox vaccine? Just a little basics there. I'm sorry.
So it has been based on demand. The federal government is developing, providing more vaccines similar to the smallpox vaccine. The Genois vaccine is being made. There are other vaccines that are available. This is the vaccine that we have available. So they're making more, and as they make more, they are distributing more. And so how many, I don't have that number as far as the number that's being made. We're focused on what we can actually obtain and vaccinate.
Thank you. And last question on the CDC calls us in the low category for COVID. We say we're high. Again, the difference is, I think, in the formulation of data. They don't count Adventist, we do. Why is that?
So great question, Kate. I'm going to let Mr. O'Donnell, who's actually had conversations with Washington Adventist. The bottom line is that we record our data feeds, multiple data sources. We've been doing this for 29 months. We try to create and provide all of the data points that are available that may slightly differ from CDC, and we've had conversations with CDC. So I'll stop there and let Mr. O'Donnell go a little deeper just to respond to your question.
Okay, first of all, I'm going to notice that unstable. Can you all hear me?
Yes.
Okay. So we have not only Washington Adventist, but with the CDC week to try to follow up on some of the discrepancies that have been noted. I believe in looking at the CDC numbers today, they were listing us at, they list us at medium. What we're aware of is the CDC has established this metric for community, for community levels, and this is established across the entire United States. And standardized. They, in fact, in their footnotes mention that the most accurate and up-to-date data for a specific county or state would be maintained by that county or state. The way we collect the information and report it on our dashboard, our emphasis is to be as timely as possible. We collect our hospital data across Maryland. Every day, our hospitals report those census across both COVID and non-COVID patients. It includes the alternate care sites that are in Montgomery County and Prince George's County. And currently, over time, the numbers are either approach 50% of our COVID patients or actually over 50% of our COVID patients may be in that alternate care site as hospitals move stable COVID patients to a location where they can be cohorted and there's lower risk of a COVID transmission to other patients. We think it's very important that that's included in our census. And again, we report this daily. We do understand that the CDC is reporting much wider data across multiple jurisdictions, and we try to reflect that. But again, our data is a little bit different because we don't include the district's data, and we do include our alternate care site data. We're actually in ongoing conversations with them to try to determine how we might be able to align even more closely.
Thank you very much, because as you can imagine, we're trying to be as accurate as we can. And we get the question, which is it, Kate? And I'm like, I'm not sure. So this helps. Thank you.
Thank you, Kate. Good afternoon, Stephanie Ramirez, Fox 5 DC. You have some questions?
Thank you. Yes, I actually have a follow-up to Kate's latest question there. Regarding frustration from parents, especially those whose summer camps, for example, had announced that they were going to change to masking indoors because of the county's high reporting, and then reverted back to suggesting but not requiring. My question is, I mean, do you feel, or would you say it's somewhat irresponsible of the county to start announcing high transmission with not clearly identifying why the discrepancies within CDC and county reporting?
Well, no, I mean, again, we're looking at data here, and we've tried to be extremely transparent, both on our website describing where our data comes from, much as I believe the CDC attempts to do as well. But it's very important to consider not just the quantitative numbers, but also qualitatively why we're looking at that. And we're looking at these numbers related to hospitalizations to determine if one of our limiting resources in protecting people, not only from COVID, but from any illness or injury is being overwhelmed. And so we do look at that qualitatively. We do make the recommendations, not only based on that specific level as defined by the CDC, but how we actually feel qualitatively it's impacting the community. When we saw transmissions go up sharply a number of weeks ago, related to a month or so ago, related to the BA 2.12, our hospitalization was at that time lower, but we still were concerned about the transmissions, particularly in our congregate settings. And Dr. Bridgers made those recommendations to wear masks in those public settings. It was not a mandate. It wasn't recommended as a mandate, but those recommendations are made both on the quantitative and qualitative information that's available.
So Stephanie, also just to add, we've had conversations with our Health and Human Services team here, our early child care provider team here, just to provide them with additional information outside of the data dashboard and the metrics to not only encourage masking in those times. Again, when we look at our community levels or our community transmission rates, they are additive measures that we put in place. We know that there are implications when it's low, medium, or high. And we're also looking towards the fall. So first and foremost, we encourage individuals to be up to date or to get boosters, even with our early child care providers. So we're encouraging all of those parents in addition to those layered preventative measures. So while we work through the data alignment, we are messaging and having conversations with our early child care providers to provide them with up-to-date information on those public health preventative measures.
And then I just want to clarify the portion of including Adventist patients in the county who may not be from the area. Has that always been the case, or is that something more recent that has some kind of recent change or something of that nature?
We've been doing that for a majority of the time that it's been open, I believe. We had discussions early on about including that data. And again, a large number of these patients are transferred from within our region. I don't believe they're getting patients transferred from outside our region. There may be a few from hospitals in the district or Prince George's County, but I think this is really, these are representing patients that would be in our hospitals otherwise.
And
And
then
it's
another
also
question.
key,
I'm sorry.
Stephanie, it's also key that we don't count patients who are hospitalized in hospitals. Montgomery County residents who are hospitalized in Prince George's County, for example, we're also not counting them. And so before you think that we're artificially inflating our numbers, just realize that we're not, we count people who are hospitalized in Montgomery County hospitals or the alternate care site in Montgomery County. We're not counting Montgomery County patients who are hospitalized in Howard, the district, Prince George's County, or otherwise.
And then another question I have is just, where is the level of concern, or where are you all at that there's now 3 candidates for chief health officer who've backed out of that role, and how you plan to compete with now Prince George's County and DC also looking for chief health officers in the region?
I don't know if you want to say something about that, Mark, but I certainly can.
I mean, my view is, we've talked about making some changes to what we require in the health officer, and we believe that'll give us, we turned out to be kind of a unique duck in the state of Maryland, and there's no real need for that uniqueness, and I've broadened the pool of people available to us. So I think we'll wind up being fine.
County Executive, while I have you, can I also ask you on any update to why Montgomery County Police have now confirmed Assistant Chief Carmen Facciolo is no longer with the department, and are you planning to replace him with another member, or is there someone who's going to step in there?
We're definitely planning to replace him because it's a position that's vacant that we're going to fill. I can't comment on a personnel matter though, so I can't give you any more than what you know right now.
Thank you. Is that it, Stephanie?
One more, if that's okay.
Hey,
County
perfectly.
Executive, we're still waiting for the results on your race in particular. I know you've voiced some frustrations about this, but ultimately, who is responsible for the delay in Bill counting here?
I think that's something we're going to look at when this is, done. We know we've had this large number of mail-in ballots. We've got computer ballots that are processed differently than the other ballots. We have lots of things going on there, and an unusually high volume of things coming in by mail. And we're just going to have to, when this is done, sit down and figure out how you plan for this. Did we learn anything out of what we did this time? And can we do it better? And that's what we'll do. We're not going to try to do that in the midst of this. We just want to make sure people focus on getting the ballots counted and concluding this.
Thank you, Stephanie. Tom Fitzgerald, also Fox 5 DC. Good afternoon, Tom.
Good afternoon, everyone. I'll try to make this quick. Question about not knowing how many MPX cases are in Montgomery County. That sounds problematic on the face of it. Why are they not telling you how many cases you have in Montgomery County? Wouldn't you need that information to know the adequate amount of MPX vaccine you need?
Sure, great question, Tom. Currently, the Maryland Department of Health is handling the contact tracing and contact investigation. They are distributing their vaccines accordingly. It's not a pro rata vaccine distribution like we saw with COVID. So yes, we need to know the cases, but we are focused on using those vaccines as best as possible to suppress the spread. So if we know that folks are known contacts and they are at risk for spreading and they are infectious, we want to vaccinate those folks or provide post-exposure. Similarly, or conversely, I should say, we want to have enough vaccine to vaccinate those individuals who may be in at-risk categories. So the number is not as significant in trying to suppress. It is in trying to know how many cases we have, but also doing the contact tracing and investigation. We know that many of the cases that are coming in for post-exposure prophylaxis have traveled throughout the jurisdictions, DC, Northern Virginia, Baltimore City, Prince George's, and even northern points. And so that's kind of our focus, to mitigate and suppress the spread.
Kimberly, if I could ask you, some of this has an air of deja vu to it, the beginning of people trying to get COVID vaccine. Are there any particulars that how you need to store this? And are you all experiencing that as well too? A demand for this product, but yet higher levels of government that don't seem to be able to get it to you?
Well, we're able to store the vaccine that we have And we will expand in terms of providing vaccination once we're provided with more vaccines. So that's part of our plan, but what we do have, we are disseminating as per the guidelines that I mentioned earlier.
And could you talk a little bit about the registration site that you say is going to go live this week? How helpful will that be for you in determining who needs this and who doesn't?
So this is a pre-registration site, and it will be helpful to us in determining who is at highest risk that may need to be seen sooner rather than those that are looking for protection against MPX that may not be at the highest risk levels. It will also help us plan for future vaccination appointments. So being a pre-registration tool, it doesn't guarantee an appointment, but it helps us determine what appointments are needed for the highest risk first in planning for future.
Finally, Dr. Bridges, just in a general sense, people have experienced a lot of pandemic exhaustion at this point. The MPX story came along and, folks, roll their eyes about it. How concerned about this should they be?
So great question, Tom. We continue to reinforce an education as part of our vaccination strategy that anyone could catch MPX. We continue to provide how the virus is contracted with any community transmission or virus in the community. Folks need to be aware and educated, and we want to ensure that we provide as much education, not only about access to make it equitable and just to keep the public informed. We actually began doing this when the states first experienced their first cases. We put out messages. We will continue to disseminate public health advisories so that the community will know. The community needs to know. We want them to be informed either about access to the vaccines, where we are versus demand. And we're not only doing that, but we will continue to do that. We are responding to two viruses now. We have the coronavirus that's still out there, and we have wavelets that you see in the data display and some of the responses that we provided this afternoon, but there's also MPX, and we want to make sure that we maintain control and suppress both viruses.
That'll do it for me. Thanks, folks.
Thank you, Tom. Steve O'Neill, Bethesda Beat, you have other questions?
I'm not sure if the county executive will answer this, but you're in a good spot now regarding the numbers. If it flips and you're with 0.25%, will you request a recount?
If it flips,
If Blair beats you by 0.25% or less, would you
Sure.
recount?
I'm sure I would.
Okay, thank you.
Thank you, Steve. Good afternoon, Brian Sears, The Daily Record.
Good afternoon. A question for Sean O'Donnell. Sean, when you were going through the numbers on COVID earlier, you were talking about the increased number of hospitalizations among both the vaccinated and unvaccinated. I was wondering if the county, does anybody have a sense of what it looks like, what the numbers look like among people who are unvaccinated but perhaps had previous COVID infections?
So I don't have that data in front of me within the county exclusively. What we of course try to maintain awareness of the research being done at the national level in some of the peer-reviewed journals. And what they have said is that the immunity provided by previous infection is lower than the immunity provided by vaccination. And some of that could be because the vaccinations are multiple doses, include boosters. There's a multitude of factors that go in, but they are seeing reinfection rates higher in those individuals whose immunity is limited to previous infection and does not include vaccination.
And one quick follow-up in terms of the numbers of deaths that you said you're becoming concerned about. What do we know about those in terms of commonalities? Are we seeing it's similar variants or vaccinated versus unvaccinated? What do we know about those?
Oh, well, data within the county are clearly the significantly higher for unvaccinated than for vaccinated or boosted. Very clear from as far as demographics or race or ethnicity. That is something we can look into. I know you can look that up on the CDC's website for national data and over any period of time and see it does fluctuate over time. And I think it's certainly related to the specific variants and specific populations. But I don't have that in front of me at the moment, but we do look at that from time to time.
Thank you.
Thank you, Brian. Heather Curtis, WMAL. Good afternoon, Heather.
Good afternoon. I have two questions. I'll start out with the monkeypox one since we were just talking about that a few minutes ago. Ms. Townsend, you said that the state, doesn't give you information on how many cases or who has it. So in that case, how do you know who's eligible for the vaccine? Does the state, verify, or do people get, I don't know, ID cards or invitations, I guess, to get the vaccine?
Thank you for your question. That's a great question. We do so through the contact tracing. We receive referrals directly from the Maryland Department of Health, and we are provided with information about who is eligible, and then we follow up with those referrals. We also have people that contact us, and they may have been seen by a private or community provider, and at which time they've been referred to us for follow-up for vaccination.
And do you just kind of have to take people's word for it, or is there some sort of formal recommendation?
For the referrals that come from the Maryland Department of Health, there's a formal recommendation that we receive, and we follow up on those. The ones from the primary care providers, they have screened the individuals and have determined that vaccination is appropriate. For those that are self-reporting, they speak with one of our community health nurses in our disease control program, and there's a screening process at which time they determine who's appropriate for the vaccine.
Got it. Thank you. And I have another question for the county executive. Steve Bunnell, who's on this call, did an excellent report about how some of the migrants from Texas and Arizona are getting temporarily housed here. I'm wondering, how can the county help these people? And is there a possibility that some of them will be able to stay here long term?
I mean, it's hard to say because, folks, some of them had destinations, and, what the nonprofits have been doing is providing interim places for them to stay on their way to someplace else. It may well turn out that some people want to stay here, and it's not like the first time we've dealt with influxes of immigrants, and we'll deal with that as as we kind of always have the way we always have. So it'll we'll see what happens.
Yeah, I'll just add to that. 10 to 15% of the persons coming in don't have a plan. That doesn't mean that they don't develop one over the course of the time that they're there. So it's really less than 10% of people who might end up staying in Montgomery County or in the region more specifically. Obviously, there are programs that we have in place and haven't had in place for a long period of time to help newcomers coming to the county get enrolled in programs, find jobs, find housing where available. And so obviously that's a social service work program. And sometimes, the best housing can be, maybe it's in the county or maybe it's not, but we help them get to wherever they're going to end up if they don't have a plan for a future destination. So that is part of the programming that we've had in place for a number of years.
Do you have any idea how many people are being housed in a hotel, and is the county getting more people than it can help?
So not everyone's being housed in hotels. First off, we do have residents being placed, and only the residents we only bring in from the district those residents that we have a place to keep them. Obviously, with them being sent most typically directly to Union Station, SAMU, the international organization who we've been working with, only brings to Montgomery County what we have capacity to hold, which typically is right around the 50 number. I think I've seen published is accurate, but that most of those are not actually put into hotels. But in rare circumstances where we feel like a COVID quarantine is necessary, we have hotel people. for a few days to allow them to clear that quarantine, but the majority of people are not housed in hotels.
That's correct, Dr. Stoddard, 58.
Is that it, Heather?
Yeah, just one quick follow-up. If they're not housed in hotels, what other accommodations can the county offer them while they're deciding where to go and what to do next?
The majority of work is done by SAMU. So obviously they've received a grant from the federal government to support them with food and other basic necessities for the time that they're staying in the county. They're handling essentially all of the direct service. We provided them support in terms of facility management, things like that, ancillary supports. But they're doing most of the direct supports while the persons are here. Again, they are for the majority of people, they are, they're arriving here, they're getting a shower, clean clothes, some food, and then the vast majority have a plan to proceed on to another place across the country where they're with family or other people, and SAMU gets them a plane, train, taxi, whatever is necessary to get them to the final destination. They handle all that support directly.
Great. Thank you so much, gentlemen. I appreciate it.
Thank you, Heather. Up next, Kevin Lewis, ABC 7. Good afternoon, Kevin.
Hi, good afternoon, everyone. County Executive Elrich, as you've been looking over the ballot counting, I'm sure on a daily basis, what do you believe needs to be corrected here ahead of the general election so that we're not waiting for weeks on end with great anxiety, I'm sure, by you and your campaign to find out who the true victor is?
I think a couple things have to happen. I do think that we need to do an assessment of, like I said, what caused the problem. The election boards have not been well funded. This has been an ongoing problem. And I don't doubt that they don't lack for some resources in this regard. And I think, the governor needs to think really hard about his veto of that measure. And if between now and the general election, if there's anything he can do as an executive order to allow people to start counting the ballots when they come in. I mean, nothing, when he vetoed the bill, it didn't change how ballots were counted, which made it kind of bizarre. I mean, if he had problems with the signature issue, his veto didn't cure that. So I think the governor could do us all a favor, and it could be an even bigger problem come the general election, because we know the turnout's going to be more. If the governor would actually facilitate the counting of ballots early. If we had started counting 10 days before, we wouldn't have had this backlog of the ballots that we had. And I think this would have been a much more manageable project. But piling all this into something you have to do after the polls close, I think has made it overly complicated, and it's overwhelmed your ability to handle it.
Understanding Montgomery County had the most vote by mail ballots in the state, it's also been the slowest to count. Is there more to the story here than just it had more vote by mail ballots than everyone else?
I think that translates into not having enough people prepared to count ballots, because they weren't anticipated. When this all started, they were planning on being able to count 10 days early. So to staff up for everything they needed, given the volume of ballots that were out there, it didn't happen as quickly as we would have liked. I think, if we know what we're dealing with in November, the governor could facilitate this by just simplifying the process and let us start counting when we need to start counting.
All right. And then just on former Assistant Chief Fasciolo, for your entire tenure as county executive, you've talked about transparency within the department. And, here we have a high-ranking member of the department being carted out with basically no one saying, jack about what actually happened. Is this a case of do as I say, not as I do?
No, it's a case of personnel regulations and what we're allowed to talk about.
Do you support changing those regulations so there is actual transparency with the community about high-ranking members within the department that are accused of breaking policy at the very least?
I worry less about policy than I do the law. There's a difference between, whether somebody does something where you might say you don't agree with the judgment versus something that somebody does, which is illegal, but it's not a department policy. It's a general policy for personnel that protects personnel records. And I don't anticipate changing that.
And what would you say, I guess, to a resident that believes the truth should be released here with years of calls for more accountability within Montgomery County Police?
Well, I think what people have been looking for is accountability on police actions, particularly as they relate to interactions with the public, and that we're clearly moving in that direction between the accountability boards and everything else. And if this were something that would have fallen under that, it would have gone to an accountability board, which is not where obviously where it wound up. So I don't think it's a contradiction. I think it's unfortunate. But because I don't think it's a contradiction doesn't mean I can change what the regulations are regarding personnel matters.
And is the accurate language to use that he was terminated, that he resigned from the department, a mutual separation?
I'd have to talk to somebody about how this all got framed. I don't know if Dr. Stoddard knows which category it falls under, but I don't know what the final disposition was.
I don't know what we can say, but we have to come up with exactly how we have to frame that. I don't know what we can say about the separation.
Okay, and as a final question, I know he had talked about having a lawyer and was posturing, for potential legal action against the county. Has the county been put on notice about pending litigation?
Last time I saw, I didn't see a letter about pending litigation.
Any more questions, Kevin?
That should do it for me. Thank you.
Thank you so much. I believe we do have time for follow-up. Kate Ryan, WTOP. Kate, you wanted to do a follow-up question?
Sorry, I hit
okay.
you. Sorry. I did want to follow up briefly on the situation with Mr. Fasciolo, understanding that there's a lot you can't say, but if I'm a taxpayer and I'm looking at this again, as Kevin mentioned, this was a high-ranking official who came in with credentials that looked good. How much is this costing the county? Does he leave with a certain amount of salary? Can you talk about that at all? Did this cost the county? And is there anything looking back that should have given you pause in his hiring?
I can't think of anything we missed in the hiring. And again, I'd have to talk with everybody who was involved in that. Because there's a whole screening process that these things go through even before they come to me. I don't begin at the beginning of the screening process. So we can have that conversation.
And then in terms of, again, we don't know if he was terminated, resigned, et cetera. Is there a cost associated with this?
I imagine there's always a cost with something in terms of what a person's entitled to in terms of remaining leave and stuff like that. But I don't think there was anything extraordinary.
Okay. And then
nothing was done out of the ordinary. Let's put it that way.
Okay. And on the nature of the position itself, why is this something you want to have? Why the need for a civilian in the role of assistant chief?
That's a fair question. We wanted somebody who would be an interface inside that department who didn't begin with a police perspective. One of the big issues in the community is trust of an institution. And if everybody in the institution you deal with is a part of the institution and can be seen as an agent of the institution, we thought there was a value in bringing somebody in who would not be seen that way, who did not come up, through the ranks as a police officer there, didn't have, necessarily relationships. Not that, you couldn't have a candidate who perhaps was at one time a police officer, but in this case, I think the expectation is we have somebody who has some independence and has a view that isn't shaped by strictly their experiences as a police officer. Because this isn't about just their experience as a police officer, it's about their interactions with the community. And
Isn't that
there
the
are
role
two
of
sets
the-
of lenses on this.
Gotcha, but isn't that the role of the Police Accountability Board?
That's the board's in particular actions, but this is about, more of an ongoing person who is engaged with the community on an ongoing basis. This isn't like just for somebody raised a complaint, let's bring it before the accountability board. This is somebody who works with the department, looks at, what policies, procedures are, has experiences with the community, can bring back feedback. I can tell you that, there are things he mentioned to me that I thought were really good observations and that were worth mentioning to the chief. And they weren't like orders that things had to change, but they were observations about how certain events were carried out and what might have been a better way to carry them out. But this is not the person who's handling complaints that belong in front of the board.
Thank you very much.
Thank you, Kate. I do not see any more requests for questions from members of the media. Going once, going twice. I guess we're done for today. Thank you, everybody, for joining us. We'll see you again next time. Stay safe. Good
Thank
afternoon.
you.